It's a familiar feeling, right? You're prepping for a medical procedure, stomach rumbling, mouth dry, and all you hear is that strict instruction. Nothing by mouth.
Mm-hmm.
For so long, we've sort of instinctively believed that when it comes to pre-surgery fasting, well, stricter is better.
Right. The less in there, the safer. That's the thought.
Exactly. But what if some of those, deeply ingrained rules are actually being updated, and not just for your comfort, but maybe for demonstrably better outcomes?
Yeah.
It feels like new insights from the medical world are really challenging that traditional mindset.
Well, what's fascinating here is how science just keeps refining our understanding. Even for practices that seem as fundamental as preoperative fasting, the goal is always paramount patient safety, of course. But increasingly, it's also about patient well-being, which, sometimes got a bit overlooked in these really strict situations.
That focus on patient well-being, that certainly feels like a significant evolution. And that's really at the heart of our deep dive today. We're going to cut through the noise, get to the core of the latest guidance on preoperative fasting, specifically looking at the American Society of Anesthesiologists 2023 practice guidelines.
Okay.
We'll explore how these updates impact healthy adults and kids, covering everything from clear liquids and what they can actually contain to the, surprising truth about chewing gum.
Yeah, that one always raises eyebrows.
Right. So our mission is to arm you, our listener, with the most current evidence-based info, making you truly well-informed. Okay, so before we dive into these updates, let's just set the stage a bit. Why do doctors tell us not to eat or drink before surgery in the first place? I mean, it can feel almost unnecessarily harsh sometimes.
Well, this brings up a critical point. The primary concern is something called pulmonary aspiration.
Okay.
Basically, that's when gastric contents, what's in your stomach, inadvertently get into your lungs.
Which sounds bad.
It is. While it's thankfully rare, occurring in about 1.1 out of 10,000 adults and maybe 1.3 out of 10,000 children having elective procedures, it can be life-threatening. Yeah, the source material notes that in a 2021 analysis, a really high number, like 57% of aspiration incidents resulted in death.
57%.
Yeah. And another 15% led to permanent severe injury. So the traditional fasting rules, they're designed to minimize what's in the stomach to lower this really critical risk.
Okay, so the stakes are incredibly high.
Yeah.
Given those risks, how did the previous guidelines balance that safety with patient comfort, specifically around clear liquids?
Right. So the 2017 ASA guideline, it already stated that clear liquids like water, black coffee, black tea, pulp-free juice, those were safe up to 2 hours before anesthesia.
Okay, so 2 hours was already established.
Exactly. This 2023 update is what they call a modular update. So it doesn't scrap the old guidelines. It specifically builds on them. It addresses specific questions that weren't fully covered before.
Oh, okay.
Think of it like adding new, finely tuned components. Things like guidelines on carbohydrate drinks, protein additions, chewing gum, and specific fasting times for kids.
Got it. So having established the why behind fasting, let's pivot to the exciting changes, specifically focusing on what you can drink, because this is where the guidelines really challenge those old assumptions. The new guidelines have a strong recommendation for carbohydrate-containing clear liquids. What's the practical impact of this for someone facing a procedure?
Well, the overarching takeaway here is a significant positive shift for the patient experience.
Okay.
For healthy adults having elective procedures, the guidelines strongly recommend drinking clear liquids with carbohydrates in them up to 2 hours before anesthesia.
Strongly recommend.
Yes, strongly. The evidence, which they rated as moderate strength, indicates that this really does significantly reduce hunger and thirst compared to fasting completely.
So you don't have to feel quite so miserable waiting. That truly changes things, doesn't it?
It really does. A big comfort factor.
And how much are we talking about, like volume-wise?
The trial showed that up to 400 milliliters is an appropriate volume. That's about, 13.5 ounces? And the carbohydrates themselves, they can be simple, like you find in clear fruit juices, or complex, like in those specific carb-loading drinks made for pre-op.
Ah, those special drinks.
Yeah. Interestingly, though, the evidence didn't find any superiority of the complex ones over simple carbs, not in terms of leftover stomach volume or even in reducing hunger.
Huh. So juice is fine. What about adding protein to these carb drinks? Is there any extra benefit there?
That's a good question. The guidelines state there's actually insufficient evidence to recommend protein-containing clear liquids preferentially over other clear liquids.
Oh, really?
Yeah. All the protein drinks they studied also had carbs in them, so it was hard to kind of tease out the protein-specific effect.
I see.
The strength of evidence here is very low. And when we say very low strength, for you, the listener, what that basically means is the studies they looked at were maybe small, or the findings weren't totally consistent.
Okay.
It's enough to suggest, well, we don't see clear harm here, but it's not enough yet to make a strong recommendation that it's actually better. So for now, sticking to just the carbs in your clear liquids, that seems to be the main takeaway for those benefits, like reducing hunger and thirst without, increasing that aspiration risk.
This focus on patient comfort during that, often anxious, pre-op wait it's a really welcome shift.
Absolutely.
And speaking of comfort, let's move from what you can drink to another surprising area.
Yeah.
Or maybe a surprising lack of discomfort. The curious case of chewing gum.
Ah, yes, the gum question.
It feels like one of those things you just know you shouldn't do before surgery, right? It's almost a gut feeling.
You'd think so. But what's vital to grasp here is that the 2023 guidelines suggest not delaying elective procedures for healthy adults who have chewed gum.
Really? Not delaying?
Not delaying. The crucial part, though, the absolute key, is that the gum must be removed before any sedative or anesthetic is given.
Okay. Oh, okay. So if you accidentally chewed some gum, your surgery isn't automatically canceled. That's a big shift from what many people think.
It is.
What did the research show that led them to that conclusion?
Well, the evidence, again, it's rated as very low strength, but it suggests that while chewing gum might minimally increase the residual gastric volume, that's the amount left in your stomach when anesthesia starts.
Right.
It's a pretty small difference, an average of about 7.6 milliliters more compared to fasting.
Tiny.
Yeah, pretty small. And crucially, they didn't detect any difference in gastric pH, that's the acidity level, which is important for safety. And importantly, no aspiration events were reported in the studies they looked at.
Okay, so the takeaway isn't really that we should chew gum, but maybe that it's not the big deal we thought it was.
Exactly.
What's the significance, then, of the task force making such an explicit statement about something that doesn't really offer a benefit?
Precisely. The task force concluded that while they don't recommend chewing gum because there aren't demonstrable benefits if a patient does chew gum, maybe for personal comfort, delaying their scheduled elective procedure just isn't supported by evidence of harm. It's sort of about not penalizing patients for something that the current evidence suggests isn't a significant risk factor, assuming it's managed properly, meaning removed.
Right, removing it is key. Okay, now let's shift to our youngest patients. I know for so many parents dealing with a hungry, anxious child before a procedure, that's an almost impossible challenge.
Oh, absolutely.
How might these guidelines, even with their, current limitations, significantly ease that burden for families, particularly around clear liquids for kids?
Yeah, this is a particularly important area because in practice, the fasting duration for children is often much, much longer than recommended.
Longer, why?
Well, scheduling, hospital flow, lots of reasons. But prolonged fasting has really well-known adverse consequences for kids.
Like what?
Increased thirst, hunger, anxiety, nausea, vomiting, pain, even potentially dehydration or electrolyte imbalance in some cases. So easing that burden is a definite key focus.
Wow, that sounds miserable for everyone involved, especially the child. So is the 2-hour clear liquid rule still the standard for them? Yeah. Or is there a move towards shorter times?
Well, this is where it gets a bit nuanced. The guidelines state there's currently insufficient evidence to make a definitive recommendation to reduce the clear liquid fasting time to 1 hour versus 2 hours for pediatric patients.
Okay.
And again, the strength of evidence is very low. That very low strength just means the current data isn't strong or consistent enough for a universal recommendation yet.
Got it.
However, they do provide what they call a best practice statement.
Okay.
Basically, to avoid that prolonged fasting in children, efforts should be made to allow clear liquids in low-risk kids as close to 2 hours before procedures as safely possible.
So while they can't make that official, strong recommendation for 1-hour fasting based on current evidence, the emphasis is still very much on minimizing that fasting time, getting as close to that 2-hour mark as they safely can, really for the child's well-being.
Exactly. Minimize the misery, essentially. And what's fascinating here is that while the official ASA update doesn't recommend 1 hour, some European and Canadian guidelines have actually moved to recommending 1 hour clear liquid fasting in children.
Oh, interesting. So there's a global debate happening.
Definitely. It indicates a global shift and an ongoing discussion in the medical community.
Right.
The evidence they looked at on stomach volume and pH for kids fasting for 1 versus 2 hours, it just showed inconsistent results across the different studies. That makes a strong recommendation really difficult at this point.
Right. They need more consistent data.
Yeah.
So pulling this all together, what does this mean for you, the listener, whether you're preparing for a procedure yourself or maybe helping a loved one navigate this?
Well, stepping back, the broader implication seems pretty clear. These guidelines really reaffirm that for healthy patients, short fasting times for clear liquids are safe.
Okay.
And they can significantly improve comfort, the core message. Those carbohydrate-containing clear liquids can really cut down on hunger and thirst compared to traditional fasting, or even just plain water. Without apparently increasing that aspiration risk. And that long-standing fear around chewing gum before surgery, that can largely be put to rest as long as, and this is key, it's removed before anesthesia.
This really does feel like a much more patient-friendly approach than the old, nothing at all mentality.
Absolutely. And the guidelines also stress something else important. The need for a robust local effort at every hospital, every clinic. Meaning disseminating this information, educating all the patient care teams, nurses, doctors, schedulers, updating policies, the literature they give patients, even the posters on the wall.
Consistency.
Yes. Consistency in messaging is so key so that patients get the same correct instructions from everyone they interact with right up to the moment of their procedure, avoids confusion and anxiety.
That makes a lot of sense. It's clear the journey of understanding here is ongoing. Building on this new guidance, what are the big questions that still need answers in this field? Where does the research need to go next?
Yeah, this leads us to think about several crucial research gaps that the guidelines themselves specifically highlight.
Okay.
There's a strong need for more powerful randomized trials looking at uncommon adverse events, and critically, more focus on patient-reported outcomes, like anxiety during that fasting period. How do these changes feel to the patient?
Right, the human experience part.
Exactly. We also need more studies comparing different types of clear liquids, including things like milk or cream added to coffee or tea. That's such a common question patients ask.
Oh, yeah, definitely.
And critically, there's a need for more rigorous comparisons between that 1 hour and 2 hour clear liquid fasting window, specifically in kids, since, as we mentioned, some global guidelines are already diverging there.
That seems crucial for settling that debate. Wow, this has been a truly enlightening deep dive. It's really remarkable how much nuance and evolution there is in something that seems as straightforward as pre-op fasting rules. You've now got, hopefully, a comprehensive understanding of these crucial updates moving far beyond just a simple news headline.
Yeah, and the takeaway for you, the listener, it's clear. Don't hesitate to discuss these updated guidelines with your own care team. Understanding the why behind these medical recommendations really empowers you to advocate for your own comfort and safety.
Absolutely. And that's what we aim to do here. Give you the knowledge to navigate these complex topics with, a bit more confidence. We hope this deep dive leaves you with a clearer understanding and maybe a little less hunger and thirst next time you might be facing a medical procedure.
Hopefully.
Now, for your next thought to mull over. If we can safely drink certain liquids before surgery, challenging that old wisdom, what other long-standing medical rules might be ready for a reassessment in the light of new evidence?